Hello everyone, I'm Anastasia signing in from Nora's. In our previous session, as we have started discussing about enema, there we have got to know what it is, what are the uses, the purpose, the two types of enema, as well as the four methods in which enema can be provided. In this session, we will be discussing about the various steps that we need to follow while performing this procedure. As we have discussed that enema is defined as the introduction of fluid into the rectum. This is a procedure which is performed for the evacuation, or we can say for washing out the waste materials from the lower bowel. This enema administration involves instilling a solution or fluid into the rectum, colon, and large intestine. And this can only be done by using a flexible plastic tube with several large holes at the tip. So now, before we perform the procedure, as a nurse, we must first do the preliminary assessment. So here what we need to do is we need to check the doctor's order for any specific precaution. We need to diagnose the condition of the patient. We also need to assess their abilities as well as limitations concerning movement. We need to assess their level of consciousness. We need to check the availability of the articles. We need to check if any extra help will be needed for performing this procedure. We also need to inspect if there is presence of lesion on the perineal or the rectal area, and we also need to assess or to get a detailed idea of which nature of enema has been ordered. So here, once this preliminary assessment has been done, you can then prepare the patient and the environment. During this preparation, the first thing you as a nurse must do is you must explain the sequence of procedure to the patient, because if she or he will get a knowledge of what is to be done and what is its purpose, then only it will enhance their cooperation level. As a nurse, you also need to make sure that you arrange all the articles required in the patient's bedside. You need to provide privacy to the patient. You must cover the patient with bed sheet. You must also place a Macintosh and a towel under the patient's buttocks. You must then place the patient in a left lateral position. You must keep the bedpan under the bed over a stool. You must also make sure that you adjust the IV pole, which will be used for providing the enema at the required height. So this is what you as a nurse must do in order to prepare the patient as well as the environment. And since I have told you that you must collect all the articles and you must place it in the patient's bedside, so let us see what are the articles that will be required for this procedure. So here we will be requiring a clean tray containing the enema cans, the rubber tubing, the glass connectors, as well as the screw clamp, a Macintosh and a towel, a rectal tube, or even a rectal catheter, which will be placed in a kidney tray. We will also be needing Vaseline in order to lubricate the tube. We will be needing a pin measure, soap jelly in a bottle, IV stand, toilet tray, two bedpans, clean linen if required, a bath thermometer, as well as rack pieces and K basin. So these are the various equipments which you must arrange before performing the procedure. So here, once the equipment has been arranged, once the preparation of the patient and the environment is done, then you can start off with the procedure. The first thing that we must do is we must inform the patient about the procedure. Here, as I have told you, that by doing this, it will help to enhance their cooperation. So, educating the patient or telling them why this procedure is being performed is very important. Then, before we start off with the procedure, we must also wash our hands thoroughly. This will prevent cross contamination. We must organize all the equipments which will be required for an efficient procedure, as well as we must place a Macintosh and a towel under the buttocks of the patient to protect the bed linen from being soiled. Then we can start preparing the solution. Here, while preparing the solution, it is very important that we must keep in mind the solution must not be hot or must not be cold, whereas it should be lukewarm. The temperature of the solution must be about 105 to 110 degree Fahrenheit, because in this manner, by providing a lukewarm solution, it will prevent chilling of the patient, which can lead to even presence of discomfort. So once the solution has been prepared, we must attach the rectal tube to tubing. We must expel the air as well as clamp the tube. So you might be thinking, why are we clamping the tube? Although allowing air to the intestine is not harmful, however, in certain cases, it can also lead to distension. In order to prevent this distension from occurring, it is necessary that the tube must be clamped. We must then hang the enema can with solution in the IV stand at the height of 18 to 24 inches from the bed, because through this manner, gravity will be forcing the solution to enter the intestine. Once this is done, we must then advise the patient to be in the left lateral position or even in the Sims position with their knees flexed, because this would allow the enema solution to flow downwards by gravity, as well as along with the natural curve of the sigmoid colon and the rectum, thus improving the retention of solution. Then next, we must place the bedpan within easy reach in order to provide it to the patient if they want to defecate. Then we must wear our gloves and we must lubricate at least 4 to 5 inches of the catheter tip of the rectal tube. By wearing gloves, it would help to prevent our hands from being in contact with the microorganism, and by lubricating the tube, it would help in the easy insertion as well as passage of the tube. Once the tube has been lubricated, we must gently spread the buttocks. While we are doing this, we must advise the patient to take a deep, slow breath through their mouth. By doing this, it would help to relax their anal sphincters. We must then start inserting the rectal tube into the rectum for about 3 to 4 inches and hold it in place. And here you might be thinking, why 3 to 4 inches? We do so because by inserting it 3 to 4 inches, it would help to pass the external as well as the internal sphincters. So once the tube has been inserted, we can then release the tubing clamp. Once this tubing clamp is released, then only there will be flowing of the solution. And here, while we are releasing the tubing clamp, we must make sure that the solution is being introduced slowly into the colon or into the rectum or the large intestine in order to prevent this tension. So why must we observe the patient? Here, if the patient complains of cramping, if the patient complains of presence of extreme anxiety as well as inability to retain the solution, then what we can do is we can lower the solution container, or we can even clamp or pinch the tubings for a few seconds. This technique would help to relax the muscle as well as prevent the expulsion of the solution. So while administering, we must administer the entire solution or as much as the patient can tolerate. Here, even if administration of the entire solution is possible, we as nurses must make sure that we clamp the tube before the solution clears the tubing, because if we do not do so, it would lead to the passage of air, which can again lead to distension. So once the solution has been administered, we can slowly remove the rectal tube by gently holding the buttocks together, because this amount of time usually allows the muscle contraction to become sufficient as well as to produce good results. So once the tube has been removed, we must then reposition the patient to their comfortable position in order to enhance their comfort level. And as a nurse, we must document the procedure. Here, why do we document? We do so in order to prevent the repetition of the procedure. Here, while we are documenting, we as nurses must make sure that we mention the type and amount of solution used, the color, consistency, as well as the amount of stool return, the condition of the anus and the surrounding area, the status of the vital signs before and after enema is provided, the description of adverse reaction during enema, the abdominal assessment before and after enema, And if the patient complains of any discomfort after the procedure, this also must be noted. And we must also note if patient teaching or client teaching regarding the prevention of constipation has been provided or not. So these are the various things that we must document. So after you have documented, what you must do is you must again go back to the patient, you must check their status, you must ask them queries if they're having any complaints of discomfort, and you must also be there with them in order to provide the bedpan if they have the urge to defecate, or even to assist them to the washroom. And if medicated enema has been provided, here in certain cases medicated enema are expelled immediately and may need to be repeated using a fresh solution. So depending on that, this can again be done. And if the patient has listed certain orders that needs to be done after the procedure for the patient, this must be done accordingly, as well as if the patient is having any complaints, then we can consult with the physician in order to assist the patient with retaining the enema after installation. We can apply gentle pressure to the rectal opening by using a 4x4 gauze pad or by squeezing the buttocks together. We can also tuck this gauze pad between the buttocks in order to collect the seepage. We must cover the patient once the procedure has been performed, and we must advise them to lie down for at least 10 to 15 minutes. And if the patient has been provided with a medicated or a retained enema, then we must cover the patient after the procedure has been done, and we must also tell them to lie down in bed for at least 10 to 15 minutes in order to allow time for the solution to take effect. And then we can also assist the patient to wash the perineal area if they are not able to do it by themselves. We must replace back the articles and discard the ones which are required, as well as we must wash our hands. These are the various steps that you must do even after the procedure has been performed. So now here we have come to the end of the topic, whereby in today's session we have discussed about the various steps that we must follow for providing enema. Here we have come to know that before we even perform the procedure, we have to conduct the preliminary assessment, we have to prepare the patient and the environment, and then we have also learned about the various steps that we need to follow during the procedure, as well as we have discussed about the things that we still need to do after we have done the procedure, the aftercare. So I hope you have got a clear understanding of this topic. I'll be meeting you in my next session. Until then, have a good day. Thank you.